Exercise can be deeply rewarding and beneficial. Studies have shown it can boost your immune system and improve mental health, so it's no wonder that the government and public health officials have been recommending everyone get a decent level of physical activity every day to protect themselves from the coronavirus. But for someone suffering from an exercise disorder, the message of stay active to stay healthy can be received quite differently. Here's Dr. Helen Ridge, clinical lead with the National Research Institute for Eating Disorders in Australia.
With all the gyms closed, with all the formal kind of exercise places closed where people might have had support from a trainer or, a class teacher who might have been able to keep them in check or notice, hey, you're coming every day and going excessively, that's gone. So people are kind of doing solo isolated exercise, which is more problematic because it can be very driven. Whereas when you're doing it in a group, it's social, which is a nicer thing.
According to the Journal of Eating Disorders, compulsive or excessive exercise manifests in two main ways. 1. Excessive exercise, where a patient feels driven to perform in response to an obsession or according to rules that must be applied rigidly. And 2. Exercise that is aimed at preventing or reducing distress or at preventing some dreaded consequence. The restlessness caused by being at home, as well as the general anxiety of coronavirus, has been a dangerous trigger for people with an exercise disorder. Instead of going to the gym, social media pages are rife with home workouts, and it's increasingly easy to become slave to the calories burnt feature on your smartwatch.
And for most people who don't have, that internal dialogue or the berating dialogue around I need to exercise, that's fine. People can manage that. But if you have that tendency towards over-exercise, then that would definitely be a trigger, definitely be a reason to have those strong urges.